In this video, we're going to look at the first step when you're performing wound care, and that is actually assessing the wound itself. So in order to do that, the very first thing that you need to do is remove the existing dressing. Now, when you're doing this, you can wear clean gloves and just gently pull back, being careful of the tape. Sometimes I say the worst thing we do to patients is pull tape off. Now, just know that if you do need to get deeper in and remove some kind of packing like you see here, you'll need to use sterile gloves or you can use sterile forceps. So if you get the sterile forceps, you can use those to gently and carefully remove the packing from inside of the wound. So now that the wound is exposed, you can actually assess it. So first you want to look at the color and the characteristics of the wound bed. Is it red? Are there streaks of yellow? Is it black or green? Is it moist? Is it dry? Is it leathery? Those are all going to tell you a lot about what's going on. In this case, the wound bed is red and bumpy, which tells us there's some granulation tissue, which means it's beginning to heal. You also want to look at the drainage and the edges of the wound. In this case, they're unapproximated but straight. Most of the time I look at the old dressing to look at the drainage characteristics. In this case, there's some serosanguinous red drainage. Now it's time to measure the wound. So take your tape measure and hold it above the wound, measure from the patient's head to toe, that's your length, and then measure from the patient's left to right, that's your width. Now we want to measure depth, but we don't want to just stick this tape measure in the wound because the wound needs to stay sterile. So instead, we want to get a sterile cotton-tipped applicator, open the package in a sterile fashion, keeping one end of the cotton-tipped applicator sterile at all times. The end that you keep sterile, you're actually going to stick that down into the wound bed until you reach the bottom of it. And then you're going to mark with your finger how deep that wound is. And then you can use the cotton-tipped applicator to measure on your tape measure. That way we're not sticking our finger down inside of the wound. So if you have any tunneling or undermining in your wound, you can measure those areas with a new cotton-tipped applicator in the same fashion. So now you have all of your assessment information, you can move on to the dressing change. If you need to, pause to write down your findings so you don't forget them, so you can document them later.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.